paramedics respond to more than 9,000 calls for help every day.
We've got at least 2 patients down.
Working around the clock.
Twist slowly, one leg at a time.
Fighting to save lives.
Ready, set, go.
Cameras across Melbourne give unprecedented access.
Hold on, people.
You're okay.
To the daily lives of these emergency service heroes.
Sit forward.
Tonight on Paramedics, Cullen fights to save a man choking to death.
It's definitely stressful when you're trying your best to help a patient and everything you're doing isn't working.
4, 5.
Oh, ambulance duress, please required urgently.
A young paramedic is attacked on the job.
There is never an excuse for a patient to hit a paramedic. Until this bloke is shackled, at any stage he can still lash out again.
And Tasman Amanda's patient reveals an unusual skill.
You've got a talent. I'm impressed.
It's pretty good, actually.
What sort of old man do you think you'll be?
I'm already an old man, mate.
Eamon and Mike are enjoying a quiet start to their shift. Just how Mike likes it.
I had a cup of tea in bed last night and read the news.
Oh, you did?
Yeah, I did.
And then did you complain about the youth of today?
No, because I am still technically the youth of today. I can't wait to be a little old man, mate. Eating dinner at 5, going to bed early. I'm a little bit of an old man at heart. I mean, I can rock a dressing gown. I have 2, winter weight, summer weight. I already get around in my dressing gown and mockies. That's why I love this cold weather.
Do you wear socks and sandals?
No, come on, I'm not a monster.
Mike and I have done a lot of big work together in the last few months, but the image of Mike in slippers and a dressing gown, I think that's burned into my retinas for the rest of my life.
All right, let's hit it.
Fortunately, Eamon's attention is quickly diverted from Mike's evening wear. An urgent call is coming in from the niece of an elderly man.
It's an 80-year-old male. The problem is written as mini stroke. Sounds like he's fallen down and he has some slurred speech.
Okay.
The caller is not actually able to get into the house. All doors are locked. Patient is on the ground, incapacitated.
Oh, God.
Okay, well, I'm smashing a window then, mate.
Kick the door in.
I'd love to see you try and kick a door in.
I'm confident I could kick a door in.
Pretty hard.
I'll kick doors in. If a door needs to be kicked in, I'd back myself. The last 2 occasions, first kick, door opened. Speaks for itself.
I'm more of a window smasher myself. Eamon likes to kick down doors because that's what movie stars do. So we have a bit of a difference of opinion. I also couldn't kick down a door.
But behind the banter, there's business to attend to.
Although we're having a joke, what we're actually doing is brainstorming. Okay, we've got a bystander waving down here. We're thinking about how we're going to get into this house, how we're going to access this patient. This is pretty serious. My name's Mike, this is Eamon, and who's the patient? What's his name?
Steve, his speech is slurred like he's had a mini stroke.
84-year-old Steve has collapsed on the floor of his locked house and can't get up. Since arriving to check on him half an hour ago, his worried niece hasn't been able to get to him.
Apparently there's a key here.
Oh, right, so that will need a code to access.
But can't you cut it with pliers?
No, because
So where are your dad? Oh, your uncle, sorry.
My uncle, he's in the front room. You can hear him, but I can't get in.
Right, and you don't know the code for that?
I don't know.
I tried 1, 2, 3, 4. Eamon, do you want to cast an eye on the patient? I'll just check for access back here, mate. This house could not have been more like Fort Knox. Every single window is locked, or even worse, it's got one of those metal shutters over it, so there's no way we're getting in there.
Steve, can you get to the front door?
He can't get to the front door. He's on the floor.
What's he saying?
He can't walk.
We're going to get to him. We're just going to do it the least sort of distractive way possible.
Can you pick the slot?
I wish.
Steve's speech is slurred, a classic stroke symptom that has Eamon on high alert.
The longer it takes a patient to be treated for their stroke, the more profound the damages to their brain are. It's starting to look like we're going to have to force entry into this house.
Well, it's locked up tight.
You know, we see so many people in this job who don't have family for whatever reason.
Across town, it's a philosophical start to the shift for Amanda and Taz.
I couldn't imagine growing old on my own.
I can't imagine living by myself.
No.
I think I'll just come and move in with you. If you by yourself and I'm by myself.
I'm not sure if that's a threat or a promise.
We'll live together.
If Taz makes it to old age, I am not going to be the one that looks after him. Unfortunately, his wife Pretty has signed up for that. I have not.
We can look after each other until you're old.
I certainly don't want to wipe Taz's bum now, let alone when he's 80.
That's fine. We'll live together.
Thanks, Taz.
With Taz's old age plans still in doubt, the team's been called to a 72-year-old woman who's worried she may not see tomorrow.
I think I'm having a heart attack. What symptoms are you having? I'm having crushing pains in the chest. Yeah. I cannot bend over without it crushing. All right, so I do have that help all organised there for you.
Heart attacks can quickly lead to cardiac arrest. Amanda and Taz need to get to the woman urgently.
All right, Amanda, looks like we've been dispatched to a 72-year-old female. Heart attack, crushing chest pain. It's quite a significant difference between just a chest pain and a crushing chest pain, isn't it? That word itself is enough to explain that there's a need of an urgency.
That's just how urgent it is.
Yeah, it is. Also, we got an update that there is no aspirin available. Patient home alone. Quite a bit scary, isn't it?
Yeah.
Taz and Amanda arrive to find their patient Jenny waiting for them outside, looking surprisingly fit and well.
I rang up to think I was having a heart attack. I don't know if I am or not.
When we attend cardiac patients, they can present in any manner of ways. Some patients can look perfectly fine, but in fact, they're having a heart attack.
Let's have a quick checkup. My name is Taz, and I've got Amanda with me.
Oh, hello, and who is this?
And
Oh, that's poor old Millie.
Hi, Millie. Sit back for me.
I sense that Jenny's a little bit anxious with us today, and it's evident that Millie's actually fairly anxious too.
I got home and I couldn't bend down because the pain was crushing.
okay.
And it still is a crushing pain.
Have you ever had that pain before?
No.
No, so this is the first time.
Yes. But I've probably got heart problems. I'm 72.
Okay.
Family history of heart attacks. My dad died suddenly at 50. I'm on high blood pressure tablets and cholesterol.
Okay. So Jenny's got all the risk factors you can think of. Are you smoking?
A bit.
Okay. High blood pressure, high cholesterol. Her father died at a young age. So she's got quite right to actually worry about what's going on there. She could be actually having a heart attack.
Emergency services. Go ahead, caller. Tell me exactly what happened.
I'm joking.
Okay, we'll get you some help.
Across town at Melbourne's Emergency Communications Centre, a desperate call is coming in from a man struggling to breathe.
I'm joking.
Is there anyone else with you?
No, please, no.
You need to stay on the line, okay? We've already got that help organised.
Intensive care specialist Cullen is closest to the job.
When you go to these sorts of jobs, the adrenaline's running high. Choking is definitely a life-threatening emergency.
19, 17.
If the patient's airway is completely blocked, their brain is not getting any oxygen, and there's only a few minutes before their heart will stop.
Hello, ambulance. Where are you, mate? Hello, ambulance. Go, mate. My name's Cullen. What's your name?
Cullen arrives to find 66-year-old Warren in serious trouble.
Can you talk to me?
Yeah, sorry, nothing my throat.
Have you been eating?
Yeah, a bit of ham.
Bit of ham. So when did you eat this ham?
Oh, about 5 minutes ago.
5 minutes ago. All right.
When I first arrive, I see lots of saliva coming out of Warren's mouth, which means that he's obviously not able to swallow. So I'm thinking that he's got an obstruction around his airway.
All right, open your mouth for a sec.
And I can tell by the look on his face that he's really struggling to breathe. He's giving me these eyes like, I'm going to die.
No rear access, mate.
I mean, he's conscious breathing, talking to us, able to say that he can't get up off the floor.
Sure.
Mike and Eamon are desperately trying to get to Steve, who's collapsed on the floor of his locked house.
No, it says a lockbox, but nobody knows the code.
Frustratingly, Steve can't remember the code to his lockbox, and it's starting to look like they'll have to smash a door or a window to get in.
So just when we're thinking that we're going to have to break into this house, in come the cavalry. Like a beacon of light, the fireys enter the scene.
Oh, g'day, mate.
They've got the tools and the know-how, and they are going to get us into this house quickly.
It's in behind that key panel there. Well, if you guys sort that, I'll go have a chat to our patient. G'day, mate. Can you hear me? It's just Mike and Eamon from the ambulance service. Some firefighters are here. They're going to try and get into that lockbox. If we can't get into that, we may have to cause some damage to get to you, because we can't leave you on the floor all day. It's really important to me to get access pretty quickly. But if we can avoid going in all guns blazing, damaging this man's property, that's always going to be better. That's the sound of the firefighters cutting into that little lockbox, all right? So they won't be far off. How long have you been on the floor? Sorry, since yesterday? So just give us a few more minutes and we'll be in, all right?
Mike and Eamon are worried the 84-year-old's had a stroke. The revelation that Steve collapsed a day ago has frightening implications.
With some strokes, we need to get them to a hospital within 6 hours of onset. If they fall outside of that time frame, they can't be treated. The damage is done.
Hey. Love your work, guys. Got a key.
It's a relief. It's taken us a little while to get in there, but at last we're in.
Hey. Love your work.
Beautiful. Thanks, Jen. We can finally lay proper eyes on this patient and figure out what's going on.
We're in the house, sir. Hello. Stephen? Yeah. Hello, I'm Mike. I was talking to you out the front window. I've got Eamon with me from the ambulance service. And we've got your niece here.
Mike's first priority is to assess for a stroke.
How did you end up on the floor?
If Steve's had one, the worry is, after 18 hours on the floor, he could have suffered permanent brain damage.
Can you squeeze with both hands?
I need to do a 12 lead, like a bigger picture of your heart.
Taz and Amanda are now assessing Jenny for signs of a heart attack.
Stay still.
The 72-year-old has crushing chest pains and a family history of heart trouble.
A 12-lead ECG is a good piece of information to tell us whether something sinister happening in the heart or not. ECG only takes a few seconds, but it's a long, anxious way for paramedics.
So the machine is telling me that it doesn't look like a heart attack.
Oh, good.
Yeah.
Yes. I'm so relieved.
But then we can't say anything as a guarantee.
Although her results are good, Jenny will need blood tests in hospital to confirm everything's okay. But before they can leave, there's one more important matter to attend to.
I'll need to get the dog organised. I'll just get some water for her.
I can do that.
She's on, she's got Cushing's.
Poor little thing.
So Jenny tells us that Millie in fact suffers from Cushing's syndrome, which means that Millie's body releases too much of the stress hormone cortisol, making her far more likely to become anxious in the absence of Jenny.
Make sure you give her a kiss goodbye before we go.
I am an avid dog lover. I have two of my own beautiful fur babies. I've got Rogue and Vader. So I totally understand the connection that Jenny has with Millie. Millie is Jenny's #1 priority. So to get Jenny out the door and get her into the ambulance, our #1 priority is also Millie.
Millie, where are you going? All right, there you go. There you go, mate. Millie's got more hair than me.
She does have more hair than you.
Well, she's losing it. Look at the tail.
She's
It's
gorgeous.
Like the rat stuff. That's part of the Cushing.
Yeah.
Stay, Millie. Bang in a minute.
It makes me so happy to know that Jen, who lives on her own, has her little fur baby companion, and it's so nice to know that they look after each other.
This is aspirin, so just chewable. You can just chew it.
Because she's still in danger of a serious cardiac event, Jenny's given aspirin to thin her blood.
So how long have you been in Advil?
This is my 11th year.
Oh, goodness.
I know I look like a baby, but trust me, I'm very experienced. I'm joking.
Well, everyone looks like a baby.
Well, my partner she's definitely a baby. She looks like a baby. She behaves like a baby.
What do they say? Happy wife, happy life?
Are you really married?
No, I'm his work wife,
think.
Jen.
You're not really. People think that we are, but I can't even handle one at home, let alone, another one. So...
It's really important to keep patients like Jenny relaxed and calm. Anxiety is not going to help anyone.
As they arrive at hospital, cardiac specialists are standing by to run more extensive tests on Jenny's heart.
I think it was nice to see that Jenny responded quite well to our rest and reassurance and the way Amanda looked after Millie before we left for hospital. But we still cannot rule out whether she's having a heart attack or not.
Oh, that's all right.
You look gorgeous.
All right, can you cough that out?
66-year-old Warren is still struggling to breathe.
It's a partial obstruction.
Intensive care paramedic Cullen is desperately trying to locate the piece of ham his patient is choking on.
I'm not sure at this stage whether it's in his food pipe, whether it's in his windpipe. And that's one of the things that I need to work out pretty quickly.
As more crews arrive to help, Cullen gets to work to remove the piece of ham.
Open your mouth there. I'm going to have a listen to your breathing. I'll just have a listen.
Warren's producing a lot of saliva, which means that he's obviously not able to swallow.
Doing a good job, mate. In and out.
I can hear good air entry into his lungs. So I'm starting to think that this obstruction might be in his esophagus or food pipe.
He's definitely having trouble swallowing. Yeah, you can hear a gurgle. There's something there.
Thing about it, I've got a small tube in my throat.
You've got a small what, sorry?
A small tube. And I have, I'm stuck,
Your esophagus is small, is it?
Yes.
The ham appears stuck in Warren's undersized food pipe. But even though his lungs are clear, Warren's breathing is still in grave danger.
Just wipe some of this stuff off your mouth. Right, we can't clear that.
It's the massive production of saliva that is what is threatening his life at this point in time.
Open your mouth there.
Because he has a blockage, it can't go to his stomach. So there's only two places the saliva can go. It can either come out his mouth or it'll go into his lungs, and that's not a good thing.
Anything coming up?
Effectively, Warren is drowning to death with his own saliva.
All right, Taz, we've been dispatched code 1 to a 40-year-old male in a boarding house with heart palpitations.
Yep.
And he is intoxicated.
Oh, okay.
It's the second job of the day for Taz and Amanda. It's an all too common call-out for another person who's had too much to drink.
I've been to this address before and I'll just change back waiting for them to come in.
For safety reasons, a single responder at the scene won't go in until there's backup.
I suppose my main concern would be if he's had something other than alcohol or what he's been mixing his alcohol with.
Safety first.
Oh, yeah, obviously safety first.
With the ever-increasing number of paramedic assaults happening across the state and across the country, whenever we go to a place like that, you can't help but start to feel a little bit scared.
So you've been here before?
The mood at the boarding house is tense.
I think danger is the first thing we have to eliminate before we start approaching the scene.
Is it him?
Guess so.
And the best strategy sometimes is that if you're not feeling comfortable, don't go in.
We're here for you.
People under the influence of alcohol can have an unpredicted behavior. So I'm concerned and vigilant.
What's your name? Did you call for an ambulance? What's happening?
How did you end up on the floor?
I think it's alcohol.
Mike and Eamon are assessing 84-year-old Steve for a stroke.
I want to check you for injuries.
But after 18 hours on the floor, the worry is he may already be suffering from irreversible brain damage.
Can you squeeze with both hands? So, assessing Steve, we're looking for facial droop, arm weakness, or speech slurring. All of them can indicate some damage in the brain that's been caused by a stroke. Good. And let go. Smile, show me your teeth. Excellent. Good man. I'm looking at the muscles in your face. They're looking good, all right? The good news is it doesn't look like there's been a stroke, but it's very unusual for someone to be on the floor and be unable to get up. So why is he on the floor? Any heart problems? No. Kidneys are okay? They're all right. Any pain in the neck? No. Can you...
Look, with my age, everybody's got a little bit.
Steve is playing down his symptoms, making it difficult to come up with a diagnosis.
Can you wiggle your feet for me? Good. And I'm guessing you've obviously tried to get off the floor but haven't had the strength, is that right? It's pretty bizarre with Steve. I've checked him for a stroke, I've checked his heart, checked his sugar. It's all pretty normal. For me, the lack of a diagnosis is almost more concerning than knowing what's wrong with him. All right, my friend.
Right, yeah.
No, you can't stay here. Yep. Let's get you in the back there.
Across town, Cullen is urgently transferring the choking Warren to hospital. He's still trying to clear a piece of ham stuck in the 66-year-old's undersized fruit pipe.
Have a cough. Right, just need to get that saliva out.
Warren has a small esophagus and is producing so much saliva from the blockage, it could start flooding his lungs.
We get Warren into the back of the ambulance, and I notice a deterioration in his condition. More saliva is now being held in his mouth, and he's unable to get it out.
Pass me suction. Pass me suction. Turn it on. Open your mouth.
Cullen does his best to suck the saliva out, but Warren's condition is going rapidly downhill.
He's deteriorating, yeah. Sit forward for me. Sit forward. We're going to do some back slaps. Just thrust from the front.
We're still just keeping our head above water here.
1, 2, 3.
I've been to a lot of chokings and upper airway obstructions in my time in ambulance, but this is the first time I've ever had to do chest thrusts, and that sense of urgency, I'm feeling it now.
Let's start moving slowly. Did that last suction improve, Warren? No, all right.
As Warren's condition continues to deteriorate, there's little more Cullen can do.
We're doing our best for you, mate. We can't clear this. We can only suction the saliva, okay?
It's definitely stressful when you're trying your best to help a patient and everything you're doing isn't working.
All right, we're going to lean you forward. We're going to do a back slap. Right. Give us a big cough, mate. Big cough. That's it. Now just spit it out of your mouth. That's it. All right.
Doctors in the emergency department are standing by to surgically remove the blockage.
It's insane to think that a piece of ham can cause this, that such a simple thing can put you on the brink of life and death.
That's it, my friend. And just on to your bottom for the minute.
Mike and Eamon are finally helping 84-year-old Steve off the floor.
That's it.
18 hours after he mysteriously collapsed.
1, 2, 3.
What we can't always do in ambulance is diagnose exactly what's wrong. So all we can really do for him is get him up to the hospital for further tests.
Because we've got to get down those stairs at the front.
But getting Steve out of his super secure house could be nearly as tricky as it was to get in.
We've got him onto our wheelchair, but that's the easy bit.
All right, so we've got a special wheelchair to come down the stairs on a track.
There's a massive flight of stairs to get down.
And you're there, mate.
Right. The house just makes me sigh. Built up quite high, you've probably got a great view from it. Ambo's nightmare.
Lock the door.
He said lock the door.
Yes.
You're worried about people getting in?
It's hard, I can tell you.
With just a landline for contact with the outside world, Steve, who lives alone, could have been stranded on the floor much longer.
So Steve falls into a demographic of patients that are extremely vulnerable. Frequently we do attend patients who are left on the floor for hours, days, and sometimes it can be fatal for them.
Have you ever fallen over like this before?
No.
No. Good. It's hard living by yourself and being an older person. We need to think about what we can do to make sure that if you do fall again, you can call for help straight away and not be on the floor for almost a whole day. Have you ever thought about having one of the bracelets that you wear? It has a button on it, and if you need help, you push the button.
Will be next to the telephone.
Yeah, but you're a busy man. You're going around doing things. You won't always be next to the telephone. I'm giving Steve my little spiel about, think about this, maybe put this in place, and he doesn't want to have a bar of it. What I'm going to do is, you make your own decision, but I'll ask the hospital people to explain it a bit better to you. I wouldn't want this to happen again.
I think we find with a lot of elderly patients, they're fiercely independent, and I get that. It's really difficult to say, look, I'm not as good as I used to be. I need that bit of extra help. It's not an easy thing to admit to yourself.
Steve will need to be fully assessed at hospital to find out what's caused his scary fall.
How you doing, Steve? Did he take good care of you?
Yeah, he's a good boy.
I'll try my best. You sit tight. I worry about Steve because if his niece hadn't have come by, he would have been on the floor for who knows how long. He might not have made it. I think about myself in that amount of time and, look, I'll probably be a bit of a grumpy, bit of a stoic older guy that doesn't want help. So I feel for him, I really do. There's a lot of oldies that are isolated.
I need those alarms.
Also, make sure you know the combination to your key lock.
Oh, I know.
I was really glad the fireys were able to crack that open.
They whipped that open in no time.
Yeah, that was good.
A little bit of me wanted to kick the door.
Oh, I know you wanted to kick the door in, but you will bust your shoulder or your knee or something.
No.
You will. How many doors have you kicked in?
2.
Were they locked? Did you check?
Do you know? Yeah. Do you know how many busted knees? 0.
How many dislocated hips?
1, but that was unrelated.
That's hilarious.
What's happening?
Well, I've been drinking so much.
Taz and Amanda have been called to a boarding house and are now dealing with an intoxicated patient.
What, sorry?
Do you want to sit down, mate?
We'll sit you on a chair. I think that's probably for the best.
Because of safety concerns, they're taking a cautious approach.
There you go, mate.
Here you go, take a seat here.
Oh, sure.
So just looking at the patient with the bottle in his hand, he doesn't appear to be that sick.
We'll just take this for a minute.
But that doesn't mean that he's just simply intoxicated. We need to give him a thorough checkup before jumping on to any conclusion.
Do you mind if I take your blood pressure?
You can take any pressure you want.
Okay.
Do you have any medical concerns today?
Heart murmur.
Heart murmur. Okay. Do you take medication for that?
No, don't take energy.
Are you supposed to?
Not that knows.
Are you in pain?
Oh, yeah, I want to rip my heart out.
Just gonna attach a few dots.
Are you feeling some pain in your chest, are you?
Yeah, I was going.
Try not to move. Just keep your hands still.
Nice and
Good
still.
man.
With only limited information, Taz and Amanda run a check to see if there's anything wrong with the man's heart.
Whatever we can check out on the machine with your blood pressure, your heart rate, your temperature, your ECG, your oxygen.
Everything's looking really good.
Oh, when I go to hospital, there's all the sulky in it.
Okay, let's take you to hospital.
Those readings are okay. Vital signs and everything are within the normal range, but we realize that this person may be suffering from some sort of mental health disorder. And we still need to rule out completely that it is not a cardiac event. And to do so, we need to get expert opinion from doctors and blood tests.
Cool hat. I like it. This looks like Johnny Depp from Pirates of Caribbean.
Yeah,
I think with every mental health patient or patient with alcohol intoxication, there's always a moment of that icebreaker thing, and the whole scenario can change.
Jack Sparrow.
All right, Captain Sparrow.
We finally get him in the back of the ambulance, and things take a very unexpected turn.
Have you ever seen a cow go moo?
I often hear cows go moo. Yeah, that's what they sound like. Huh? Come on.
Micah paramedic team Carina and Doddsy have also been called to a man under the influence.
Clear with anything on my left.
But unlike Taz and Amanda's pirate friend, this patient is drug-affected and violent.
The Chelsea crew are on scene there. They have been assaulted.
After overdosing on prescription drugs, the man has attacked a paramedic.
Oh, ambulance duress. Police required urgently.
It makes me angry. Nobody deserves to be assaulted, yelled at, hit, spat on, whatever it is. That's unacceptable.
She's trying to get over.
Yeah, something. Do something. Just don't do nothing.
In Victoria, one paramedic is assaulted every 2 days. Tensions in the ambulance are running high.
Dude, did you even look, champ?
He's not looking.
Assaults on paramedics can be pretty serious. You know, we've had ambos that have had broken bones and been punched quite harshly. We know there's safety in numbers. So police will get dispatched straight away, but we need to make sure we get there and look after our colleague.
I reckon we'll be pretty close. Turn them off.
Silent approach.
Sirens are cut in case the already volatile situation is made any worse.
I mean, you drive to the job, a bit of trepidation, you're a bit anxious. This could be... See the ambos as a soft target, so we have to be on high alert.
Oh, there you go. Where the policeman's are.
Where's the bull side of the cow?
The mood at Taz and Amanda's job has just taken a radical turn for the better. Their intoxicated patient is now entertaining them in the back of the ambulance.
Hey, Amanda.
Yeah.
I can't impersonate bull because I think I'm pretty full of bull.
I reckon this truck is fairly full of bull at the moment.
I don't want patient to think that I'm making fun of them or I'm making joke of them. I always try to make fun of myself, so they start feeling comfortable that, okay, they have a bit of a laugh. Most of the time, that does the trick.
Are there any other animals that you can impersonate? Pig?
Jobs turn from an absolute negative to a more enjoyable, positive job.
Pretty good, actually.
Patient is feeling better, we are feeling better, and we're having a good time.
What about a horse? You've got a talent. I'm impressed.
We've gone from a patient who potentially could have been quite aggressive to a guy who went through an entire farmyard of impersonations, and actually they were pretty good.
Come on, mate. Old MacDonald with his farm.
Oh.
Let's go.
Bottom.
Oh, now we're a shark.
I think people forget about people like this in society, but you need to realise that all they just need sometimes is a little bit of kindness.
Good man. Come on.
Make sure my friends are.
Doddsy and Carina have been called out to help a paramedic who's been assaulted by a drug-affected patient.
The job's done, mate. They've ketamined him.
Police are already at the scene and the man has been sedated. But the first responders are still at risk.
He's a pretty big boy, isn't he? Are we going to shackle him, or we're comfortable that that's going to be it for him? Because he did punch one of you, didn't he?
Yeah.
The patient's lying on the bed and he looks pretty harmless at the moment. He's been given a drug called ketamine to relax him, but we haven't given him enough to actually knock him out and put him to sleep. So at any time he could kick up on the bed, he could throw punches, he could throw kicks. Until this bloke is shackled, at any stage he can still lash out again.
So once we put these both on, we'll put him over into our truck.
Handcuffs are used to restrain the man.
Is one of you guys coming with us? Yeah?
and he's taken to Doddsy and Carina's ambulance under police supervision.
So basically, it had a heap of tramadol and stuff, history of depression, and some alcohol.
Exactly. And substance abuse of opiates.
Okay.
Paramedic Ramel was hit by the man soon after he arrived to help him.
Do we know what time he took all this stuff today, Ron? Do we know what else? So it was only tramadol that you guys could find in that aspect?
He's not meant to be on it, really.
Yeah, sure.
He doesn't know where he got it.
No worries.
We responded to a drug overdose, tramadol, which is an opiate. So we've given him some medication, midazolam, initially just in the arm, and then he basically just started to become severely aggressive. And he swung his arm and it hit me in the face. Yep. I've never been assaulted before, so it's quite upsetting.
Are you okay?
Oh, I was just shocked, because as soon as I gave the midazolam, he just went down.
Okay, but you're okay?
Yeah.
Yep. All right, no worries.
Anyone getting assaulted is not right, because we are just doing our jobs, especially paramedics.
Regardless of his whatever, he still assaulted you. So make sure that there's some paperwork that gets put in for that.
All right,
yep.
thank you.
No worries.
Anything else from us?
You did a great job, mate, that's all.
Thank you.
You're welcome. You're very welcome.
This is a game changer. Ramel's quite young in the job, so this is something now he'll think about every time he goes to an overdose. Now, it creates an angst in his workplace that he shouldn't have to have.
Because the man's had a cocktail of drugs, the paramedics still need to monitor him closely.
Good afternoon, Frankson. We have a gentleman. History of drug abuse and depression, was medazed by crew and then assaulted crew, and then ketamined.
So he's assaulted a paramedic, but we still need to care for him. This is the job that we do. And we don't know exactly what he's had, so we need to be vigilant, because all these drugs in combination have an effect with each other that can actually make you stop breathing.
At least my ambo mate's all right.
Yeah.
Could have been a lot worse by the sound of it.
Yeah.
Doddsy and Carina are arriving at hospital with their sedated patient under police escort.
You know, he wasn't thinking clearly about throwing a backhander, but it's not right.
Their patient has just committed one of the 600 cases of violence towards paramedics in Victoria each year.
All right, let's get our newfound friend out of here.
In my job as a paramedic, I'm not judge and jury. This bloke's obviously having a bad time at the moment, but I would hope that us getting into hospital would create a process of him getting help. Just being that person in the forefront to make a difference. You know, it's the reason I get out of bed every day and come to work.
It's been more than a year since mandatory jail time was introduced for people charged with attacking paramedics in Victoria. But in some cases where drugs were involved, the sentences have been overturned.
I know that gentleman was probably not in the right frame of mind. There's, you know, drug-induced and so forth, but we've all been pissed and been idiots at some stage in our life.
Controversial, I know, but I'm not for people in an altered conscious state, you know, just being thrown in jail willy-nilly or doing a sentence. I always believe in second chances in life.
Do you know what? I'm a bit cranky when it comes to this subject. You choose to take those drugs, so I don't see that as an excuse for your behaviour.
Yeah, no.
If you can't control your behaviour, don't drink and don't take drugs. It's not an excuse.
All right, that's going to the next level. We all have silly moments.
I'm not saying that I haven't done anything stupid or haven't been drunk, but I have not hit anybody who was there to help me.
I have been hit. I've been sworn at a lot. There's nothing that you can say to me that I haven't already been called at some point. Every job I go into now, when I walk through the door, I look for what somebody can hit me with. I look for what somebody can stab me with. And it shouldn't have to be like that.
It's been 2 weeks since Warren was rushed to hospital, choking on a piece of ham stuck in his undersized food pipe.
Pass me the suction. We're doing our best for you, mate. We can't clear this.
Warren needed surgery to remove the blockage and is now taking every precaution to stop another near-death episode.
I cut it up small and I always finish it off with ice cream, because ice cream slides it all down and lubricates my throat, which is really good. I go through about half a dozen boxes of ice creams a week.
Warren's trip to hospital was the latest in a long line of choking emergencies.
Oh, I've had a gutful, mate. I really have. At the moment, my tube is only mostly a third of what it should be. I'm reluctant to go out because I get scared and I don't want it to happen in front of people. It is frightening. It is scary. All I wanted is to be fixed.
Warren is now on the waiting list for an operation to stretch his esophagus. Doctors are optimistic about the outcome.
Well, it's locked up tight.
Mike and Eamon had to call backup to get into Steve's locked house.
That's the sound of the firefighters cutting into that little lockbox, all right?
He had been collapsed on the floor for 18 hours before his niece found him. Tests revealed an infection in his legs had caused the fall. The infection has now been treated, and Steve is still considering a bracelet alarm system.
I wouldn't want this to happen again.
The man who terrified she was having a heart attack.
The family history of heart attacks, my dad died suddenly at 50.
Doctors found some arteries with reduced blood flow, but after 3 days in hospital, she was given the all clear. Sadly, shortly after she came home, Jenny's loyal companion Millie passed away.
She was my friend. I loved her. I still do.
It was too hard for Jenny without her friend.
There you go, Poppy.
So along came Poppy to help Jenny stick to her new fitness regime.
I do have to make a lifestyle choice if I want to live longer, you know, like more exercise and, you know, boring food. Good girl, walkies. Walk, salads and stuff. No cream cakes. You're a good girl, yes you are.